When advising a client about choosing a suitable diet for their overweight dog, which factors should you consider and how would you justify your recommendation? Answer: when advising a client on a diet for an overweight dog, consider the following factors. Breed and age. Some breeds have higher metabolic rates and different nutritional needs. Puppies, adult, and senior dogs each require different formulations for their life stage. Activity level. Dogs with a low activity level, such as older dogs or those with mobility issues, need fewer calories compared to highly active dogs. Health conditions. Weight management can be affected by health issues such as hypothyroidism or joint problems. Consult with the vet if unsure. Nutritional content. Choose high-quality food low in calories, but rich in fiber and protein to support muscle mass and promote fullness. By considering these factors, you ensure that the dog receives appropriate nutrients without excess calories. Ensure to recommend food labeled as weight management or low-calorie formulas, which are designed to support healthy weight loss without compromising nutrition. According to Australian consumer law, providing accurate, reliable information is essential to ensure the client is aware of the benefits and limitations of dietary products. Mrs. Patel has brought her 3-month-old kitten, Luna, into the store. Luna has been scratching excessively, and Mrs. Patel is seeking advice on suitable flea treatments. Luna has not yet had her first vaccination and weighs approximately 1.5 kilograms. What advice would you provide Mrs. Patel considering Luna's age, weight, and medical history? Answer: suitable flea treatments. Recommend flea treatments specifically designed for kittens, ideally under 6 months old, and check the product for weight suitability. Luna weighs 1.5 kilograms. Avoid harsh chemicals that can be harmful to young animals. Administration instructions. Explain how to apply the flea treatment correctly. Spot-on treatments applied at the back of the neck. Preventive measures. Advise cleaning Luna's bedding, toys, and environment to prevent reinfestation. Veterinary consultation. Encourage Mrs. Patel to take Luna for her first veterinary checkup, especially as she hasn't received vaccinations yet. It's essential to ensure the flea treatment is appropriate in combination with vaccination schedules. Since Luna is still very young, caution is crucial when selecting any products. Under the Australian animal welfare standards, it is critical to provide safe, age-appropriate care and ensure the pet's well-being at every stage. Describe the steps involved in performing a daily health check on a rabbit and the significance of each step in ensuring its well-being. Answer: the steps involved in performing a daily health check on a rabbit include behavioral observation. Monitor the rabbit's overall behavior for lethargy, stress, or aggression. Rabbits are prey animals, so sudden behavioral changes can indicate illness. Coat inspection. Check for mats, excessive shedding, or signs of parasites such as fleas or mites. Skin health is crucial as untreated conditions can lead to secondary infections, eyes and ears. Inspect for discharge or signs of irritation. Discharge or redness could be a sign of infections or allergies. Dental health. Examine the teeth for overgrowth. Malocclusion, improper alignment can cause eating difficulties and malnutrition. Weight monitoring. Weigh the rabbit regularly to ensure it maintains a healthy weight, as rabbits are prone to obesity, especially if fed high-calorie food. Rabbits are sensitive to changes in their environment, and early detection of issues can prevent severe health problems. As per Australian animal welfare guidelines, proper care includes routine health checks ensuring the pet remains healthy and free from disease. Mr. Johnson recently purchased a guinea pig from your store. He contacts you a week later, concerned that the guinea pig has watery eyes and is sneezing frequently. How should you address Mr. Johnson's concerns, and what immediate steps should he take to ensure the guinea pig's health? Answer: immediate action. Advise Mr. Johnson to isolate the guinea pig from other pets to prevent potential spread of illness. Veterinary visit. Recommend Mr. Johnson take the guinea pig to a veterinarian for a proper diagnosis, as symptoms like sneezing and watery eyes can indicate a respiratory infection common in guinea pigs. Housing conditions. Check for possible stressors such as poor ventilation, drafts, or dusty bedding. Suggest using softer bedding and maintaining a warm, quiet environment to reduce stress. Preventive measures. Suggest cleaning the guinea pig's cage thoroughly and ensuring it is well ventilated to avoid further health issues. These symptoms may indicate respiratory disease (COMP-CARD-EC), which is common in guinea pigs. Proper care and prompt veterinary intervention are essential to avoid complications. Under the Model Code of Practice for the Welfare of Animals, providing accurate guidance and facilitating professional care is paramount. A customer wishes to return an opened package of premium dog food, claiming it caused their dog to vomit. Outline how you would handle this situation, considering store policies and customer satisfaction. Answer: you'll handle this by review return policies. Check if your store policy allows returns for open food. Many stores do not accept returns on open food for health and safety reasons, but exceptions might exist for quality concerns. Assess the situation, politely ask for details such as how much food was consumed and whether the dog has any pre-existing health conditions. Recommend solutions. If the return is not possible, offer an alternative solution such as an exchange for a different product or a voucher for the store. Customer education. Advise the customer that transitioning to new food should be done gradually to avoid gastrointestinal upset according to Australian consumer law. Customers have the right to request refunds or exchanges for products that are faulty or unsuitable for their intended purpose. However, stores have policies in place to protect against misuse. Balancing customer satisfaction and store policy is key. What key factors should be considered when stocking pet care products, particularly food and grooming tools, in a retail setting? Answer. Key factors include customer demographics. Understand the needs of your customer base. Stock products that align with the local pet population need. G. More dog food for dog owners. More small animal supplies in suburban areas. Product quality. Ensure the products meet regulatory standards and align with customer expectations for quality. High quality, reputable brands should be prioritized. Shelf life. Be mindful of expiration dates, particularly for perishable items like pet food. Rotate stock to minimize waste. Market trends. Stay informed about current pet care trends such as organic pet food or sustainable grooming tools to meet evolving customer demands. Price range. Stock a range of products catering to different budgets, ensuring inclusivity for all customer segments. Retailers must ensure that products comply with the Australian consumer law and meet the welfare standards outlined in the Australian Animal Welfare Act. Providing accurate information and quality products builds customer trust. Explain the importance of using point-of-sale (POS) systems and managing transactions efficiently in companion animal services. Answer. The importance of using point-of-sale (POS) systems is transaction accuracy. A POS system ensures accurate recording of sales, helping avoid errors in billing and improving inventory control. Customer satisfaction. Efficient transactions reduce wait times, enhancing the customer experience and increasing customer loyalty. Inventory management. POS systems track stock levels in real time, ensuring products are reordered before running out and helping prevent overstocking. Sales reporting. POS systems generate reports that provide insights into sales trends, helping you manage the store more effectively. Compliance. Proper use of POS systems ensures compliance with tax regulations and helps in accurate financial record keeping for audits. POS systems are an essential tool for the smooth operation of a retail business. As per Australian Taxation Office guidelines, accurate record keeping and efficient transaction management are crucial for business compliance and financial integrity. Why is it essential to educate clients on preventive healthcare measures for their pets, and what are some examples of such measures? Answer. Health monitoring. Preventive care helps identify health issues early, potentially avoiding costly treatments later. Regular checkups, vaccinations, and flea treatments reduce the risk of disease. Parasite control. Educating clients on regular flea, tick, and worm treatments is crucial, especially in areas with high parasite risk. Diet and exercise. Inform clients about the importance of a balanced diet and regular exercise to prevent obesity, which can lead to other health complications. Grooming. Regular grooming helps prevent skin infections, mething, and nails growing too long. Routine vaccinations. Advise clients on the importance of following recommended vaccination schedules to prevent preventable diseases. Preventive health measures are part of the Australian Animal Welfare Standards, which emphasise the importance of early detection and responsible pet care. Educating clients empowers them to make informed decisions and keeps pets healthy. How would you manage inventory for seasonal pet products, such as Christmas-themed pet apparel or winter bedding? Answer. Seasonal demand forecasting. Analyze past sales data to predict demand for seasonal products. Stock appropriately based on previous year's sales trends. Flexible ordering. Maintain flexibility in ordering to adjust stock levels in response to unexpected demand spikes. Promotion planning. Plan for promotional sales in advance to move seasonal stock. Offering discounts during peak seasons can help clear excess inventory. Storage and display. Ensure seasonal products are clearly displayed and easily accessible during peak sales periods. Post-season inventory. Consider discounted pricing or bundling to sell remaining stock after the season ends. Efficient inventory management ensures that popular seasonal items are readily available and prevents overstocking after the season. This approach aligns with Australian consumer law regarding fair trade practices. What are the key steps in providing advice on pet behavior modification, and how should you approach A client with a pet exhibiting aggressive behavior. Answer: key steps include seasonal demand forecasting. Analyze past sales data to predict demand for seasonal products. Stock appropriately based on previous year's sales trends. Flexible ordering. Maintain flexibility in ordering to adjust stock levels in response to unexpected demand spikes. Promotion planning. Plan for promotional sales in advance to move seasonal stock. Offering discounts during peak seasons can help clear excess inventory. Storage and display. Ensure seasonal products are clearly displayed and easily accessible during peak sales periods. Post-season inventory. Consider discounted pricing or bundling to sell remaining stock after the season ends. Efficient inventory management ensures that popular seasonal items are readily available and prevents overstocking after the season. This approach aligns with Australian consumer law regarding fair trade practices. Explain why selecting the correct grooming tools based on an animal's coat type is essential for effective grooming. Discuss the potential consequences of using improper tools and techniques. Answer: selecting the right grooming tools is vital to ensure both the comfort and health of the animal as well as to achieve effective grooming results. Different coat types, e.g., double-coated, curly or smooth coats, require different tools for optimal results. For example, a slicker brush is ideal for removing tangles in a double-coated breed like a golden retriever, whereas a comb with wide teeth would be more suitable for a long-haired breed like a Persian cat. Using inappropriate tools, such as using a fine-toothed comb on a thick, matted coat, can lead to discomfort, injury, and hair breakage. Additionally, improper grooming techniques can cause skin irritation or damage, leading to sores or infections. For instance, incorrect use of clippers on sensitive skin may cause nicks. Grooming standards, as outlined by organizations such as the Australian Animal Welfare Standards, emphasize using tools that suit the coat type and maintaining a humane approach. Misuse of grooming tools can breach animal welfare regulations, leading to potential legal consequences. Emily operates a grooming salon and encounters a Labrador retriever with visible hot spots, moist, red, irritated skin areas. The owner mentions the dog has been scratching excessively but has not seen a veterinarian yet. What should Emily do in this situation, considering her professional responsibilities and the potential risk of spreading infection? Answer: in this situation, Emily should prioritize the dog's health and safety. First, she should stop the grooming process to avoid further irritation to the affected area, as grooming can exacerbate hot spots and worsen the infection. Emily should gently inform the pet owner about the condition, advising them to take the dog to a veterinarian for a proper diagnosis and treatment plan. She should also recommend that grooming be postponed until the infection is treated and cleared. Additionally, Emily should maintain high biosecurity standards by sanitizing all grooming equipment and surfaces that came in contact with the dog to prevent the spread of the infection to other animals in the salon. According to the Prevention of Cruelty to Animals Act 1979, NW groomers are required to act in the best interest of animal welfare. Emily must follow ethical guidelines, avoid causing further harm, and refer the animal to a veterinarian, as grooming animals with infections beyond her scope can result in serious consequences. Describe the vaccination schedule and its importance for preventing infectious diseases in companion animals such as dogs and cats. Answer: vaccination is a crucial part of preventive care for companion animals. For dogs, the core vaccines include DHPP, distemper, hepatitis, parvovirus, and parainfluenza, which are given in a series of shots starting at 6-8 weeks, with follow-up doses at 1-2 weeks and 1-4-6 weeks, followed by annual or triennial boosters. Rabies vaccination is also required by law in many regions, typically administered at 1-6 weeks. For cats, the FVRCP, feline viral rhinotrachetis, calicivirus, and panleukopenia vaccine is administered similarly with initial doses at 6-8 weeks, followed by boosters. Rabies vaccination is also commonly required. Vaccinations prevent life-threatening diseases like parvovirus, feline leukemia, and rabies, which can result in severe illness or death. They also help reduce the spread of infectious diseases in the broader pet population. Vaccines are regulated under laws like the Biosecurity Act 2015 ensuring that animals receive appropriate immunization. Regular veterinary checkups alongside vaccinations also ensure the early detection of other health issues. Following these schedules helps ensure public health safety and reduces the risk of outbreaks of preventable diseases. Explain the role of biosecurity measures in preventing the spread of infectious diseases in a pet care facility. Answer: biosecurity measures are essential in preventing the spread of infectious diseases in pet care facilities by minimizing direct and indirect contact between sick animals and healthy ones. First, isolating animals showing symptoms of illness is a critical step in halting potential outbreaks. For example, new or returning animals should be quarantined to ensure they are free of diseases before they interact with other pets. Facilities should also maintain rigorous cleaning protocols, including disinfecting surfaces, cages, and grooming tools, using veterinary-approved cleaning agents to kill pathogens. Additionally, staff must wash their hands regularly, wear gloves, and change clothing between handling animals to prevent cross-contamination. Biosecurity also involves monitoring the health of all animals entering the facility, including conducting regular health checks and vaccinations. These practices not only protect the animals, but also the staff and the public in compliance with laws such as the Animal Diseases Act 2005. Enable effective biosecurity reduces the risk of outbreaks, maintains the reputation of the facility, and ensures the safety of animals under care. Proper training and adherence to these guidelines ensure a high standard of care and minimize the risk of disease transmission. James, a new groomer, is handling a long-haired Persian cat with severe matting close to the skin. The cat becomes visibly stressed and starts vocalizing loudly. How should James proceed to groom the cat while minimizing stress and ensuring safety? Answer: James should immediately stop the grooming session as soon as the cat begins vocalizing and showing signs of stress. Grooming should never cause undue discomfort or harm. First, he should assess the severity of the matting and consider whether it can be safely removed or if a vet consultation is needed. In cases of severe matting, trimming or shaving may be necessary, but this should be done cautiously to avoid injuring the cat's sensitive skin. If the cat remains highly stressed, James should implement calming measures such as taking short breaks, using pheromone sprays, or asking the owner to assist with calming the cat. Additionally, James should inform the owner about the condition and recommend that the cat receive professional veterinary care to rule out underlying skin conditions that may have caused the matting. It's essential for James to maintain a calm, patient approach and avoid rushing, as this could further distress the animal. By following these guidelines, James ensures the safety and well-being of the animal and complies with ethical standards as outlined in the Animal Welfare Act 1999 CTH, ensuring that the animal's welfare is never compromised during the grooming process. What are the key differences between practical grooming and grooming for show, and how do these differences impact the grooming process? Answer: Practical grooming and show grooming serve distinct purposes and involve different approaches. Practical grooming focuses on maintaining the pet's overall health, cleanliness, and comfort. It prioritizes basic hygiene such as bathing, brushing, nail trimming, and ear cleaning. Groomers aim to remove mats, tangles, and loose fur to prevent discomfort or infection. Show grooming, however, is more detailed and aims to present the animal in its breed-specific ideal form. This type of grooming involves intricate styling, precise trimming, and often special techniques to enhance the appearance of the coat and body. It may include the use of specialized tools like thinning shears and coat products to ensure that the animal meets breed standards as outlined by organizations such as the Australian National Kennel Council, Inc. The time, effort, and skill required for show grooming are considerably more demanding, and it may take hours to perfect the look. Both types of grooming require knowledge of the animal's coat and skin condition, but the emphasis in show grooming is on aesthetics, while practical grooming focuses on health and comfort. The Australian Groomers Association provides guidelines on both types of grooming, stressing the importance of health considerations in every grooming practice. Why is early detection and treatment of external parasites, such as fleas and ticks, critical in companion animals? Answer: Early detection and treatment of external parasites like fleas and ticks are crucial because they pose significant health risks to companion animals. Fleas can cause severe itching, skin infections, and lead to flea allergy dermatitis. In extreme cases, fleas can cause anemia due to blood loss, particularly in young or elderly animals. Ticks, on the other hand, are vectors for several serious diseases, including Lyme disease and ehrlichiosis, which can have long-term health effects if not treated promptly. Early intervention helps prevent these conditions from escalating and causing further harm to the animal. Additionally, treating parasites early can prevent infestations from spreading to other animals or humans. Preventative treatments, such as spot-on treatments, oral medications, and flea collars, are essential for managing parasite risks. As outlined in the Veterinary Medicines Regulations 2021, these treatments should be administered according to professional guidelines to ensure their safety and efficacy. Regular checks for fleas and ticks, especially after outdoor exposure, and prompt treatment ensure the health of both the pet and the household. Failing to address parasite infestations promptly can lead to costly veterinary treatments and the potential spread of diseases. Sarah owns a grooming business and notices a sudden increase in dogs with tick infestations in her area. What steps should Sarah take to manage and prevent the spread of ticks in her facility? Answer: Sarah should immediately implement strict tick prevention protocols within her grooming facility. First, she should conduct thorough tick checks on all incoming dogs and any animals that may show signs of ticks. She should inform clients about the increased prevalence of ticks in the area and recommend that they use preventative treatments such as tick collars or topical spot-on treatments. Additionally, Sarah should ensure that all staff members are trained to recognize tick infestations and act quickly to remove ticks safely. She should also reinforce the importance of hygiene by regularly cleaning and disinfecting the grooming areas, paying close attention to surfaces where ticks may reside. If Sarah is dealing with multiple tick-infested dogs, she should consider postponing grooming sessions for those animals until they have been treated or cleared of ticks to prevent cross-contamination. By taking these precautions, Sarah helps ensure the safety of the animals and complies with public health and animal welfare standards as specified in regulations like the Animal Welfare Act 2000 and SERB. Discuss the importance of educating pet owners about the grooming needs of their pets. Answer: educating pet owners about the grooming needs of their pets is essential for maintaining their pet's health, comfort, and hygiene. Pet owners must understand that grooming is not just about aesthetics, it is a key part of their pet's overall well-being. For example, regular brushing helps prevent mats, tangles, and excessive shedding, while also promoting healthy skin by stimulating blood circulation. Pet owners should also be educated about the importance of dental care, nail trimming, and ear cleaning to avoid infections and other health issues. Furthermore, certain breeds require specific grooming techniques, such as hypoallergenic grooming for poodles or trimming for short-hair breeds. If owners are unaware of their pet's specific needs, it can lead to neglect, discomfort, or even health complications. Groomers should also teach owners how to detect signs of skin infections, parasites, or other health issues early on, promoting proactive care. This aligns with Animal Welfare Act principles by ensuring that pet care is not limited to grooming but also extends to regular health maintenance, ensuring that pets live happy, healthy lives. How does proper hydration impact a pet's coat condition, and why should groomers consider it during the grooming process? Answer: proper hydration plays a crucial role in maintaining a pet's coat condition as it affects the health of the skin and hair follicles. Dehydration can lead to dry, flaky skin and brittle hair, making the grooming process more difficult and potentially painful for the animal. Groomers should ensure that pets are well hydrated before and during the grooming process, especially if the coat is particularly dry or tangled. Hydrated skin is more elastic, reducing the likelihood of irritation or injury during grooming. Groomers should also educate pet owners about the importance of providing adequate water, especially during warmer months, and recommend a diet rich in essential fatty acids, which help maintain healthy skin and coat. In addition, certain grooming treatments, such as moisturizing shampoos or conditioning treatments, can help replenish the skin's moisture. Groomers should always be mindful of the animal's hydration status, as it directly impacts the overall grooming experience and the pet's health. This holistic approach aligns with pet care regulations under the Veterinary Surgeons Act and ensures that animals receive the best care possible. You are tasked with safely restraining a medium-sized dog showing signs of stress, including panting, wide eyes, and tail tucked between its legs. Which combination of techniques should you prioritize to ensure safety for both the dog and yourself? Answer: when dealing with a stressed dog, the first priority is to minimize further stress and ensure safety. The correct approach involves using a lead to maintain control over the dog while speaking in a calm, reassuring voice to reduce anxiety. The dog should be guided slowly and gently, avoiding sudden movements that could startle or escalate the situation. While muzzling may be considered, it should be done only when necessary and not as the first choice. The aim is to allow the dog to feel secure, not further restricted. Using a crate could be helpful for containment, but it is not an immediate solution when the dog is already displaying signs of stress. Lifting the dog is generally not recommended in this situation, as it could cause additional distress or physical injury. According to the Australian Veterinary Association, AVA, recognizing stress signals like panting and a tucked tail and responding with appropriate restraint ensures the safety of both the animal and the handler. By using minimal restraint techniques, you create a safer and more comfortable environment for the dog to calm down. Maria is a veterinary assistant in a clinic. During a routine checkup, she notices a bird with plucked feathers, lethargy, and signs of malnutrition. The owner claims the bird eats well but admits it is rarely let out of its cage. Maria suspects neglect but does not want to accuse the owner directly. What should Maria do in this situation? Answer: Maria should first document the bird's physical condition, including the plucked feathers, lethargy, and other signs of malnutrition. She should note the owner's statements and any discrepancies in the care routine. Her next step is to discuss her concerns with her supervisor or the veterinarian on staff. According to the 5 freedoms of animal welfare, animals should not suffer from malnutrition or lack of exercise, both of which are apparent in this case. After discussing her concerns with her supervisor, Maria should follow the clinic's established procedures for reporting suspected neglect. This may involve a formal notification to local animal welfare authorities. Maria is also responsible for educating the owner about proper bird care, including the importance of a balanced diet, mental stimulation, and regular out-of-cage time. If neglect continues despite education, Maria should report the situation to the appropriate authorities to ensure the animal's welfare. The Prevention of Cruelty to Animals Act requires professionals to act when abuse or neglect is suspected, ensuring the animal receives necessary care and protection. When grooming a cat that resists being handled, which of the following is the most effective and humane approach? Answer: the most effective and humane method for grooming a resistant cat is using the towel wrap technique. This involves gently wrapping the cat in a towel, leaving only its head exposed. This technique helps calm the cat by limiting its movement while still allowing the groomer to access the areas that need attention. By reducing the cat's ability to lash out, it minimizes the risk of injury to both the cat and the groomer. According to the American Animal Hospital Association, minimizing stress and discomfort during grooming is essential to prevent negative associations. Options like scruffing, option A, can cause discomfort and anxiety for the cat, leading to potential aggression. Muzzling, option C, may not be suitable for all cats and can cause additional stress. Sedating, option D, should only be done under the supervision of a veterinarian. The towel wrap is a gentle, effective solution, aligning with ethical handling practices that prioritize the animal's comfort and safety. Which of the following practices best aligns with ethical breeding principles? Answer: ensuring genetic diversity to minimize health problems. Option B aligns best with ethical breeding principles. Ethical breeders focus on the health, temperament, and genetic compatibility of breeding pairs to avoid hereditary diseases and promote healthy offspring, as outlined by the Australian Pet Industry Association. EPIA. Responsible breeders select mates based on their health history and overall well-being, not solely on appearance. Breeding for physical traits like extreme features, option A, or for financial gain, option D, disregards the long-term health of the animals. Selecting animals based on extreme traits, such as breeding for exaggerated body types, can lead to congenital issues like respiratory problems or joint disorders. Ethical breeders also ensure that the animals are well cared for and live in appropriate conditions until they find suitable homes. The key principle is to prioritize the animals' health and welfare, ensuring that the breeding process does not cause harm or unnecessary suffering. Kevin is tasked with relocating a large snake at a wildlife park. The snake is known to be non-venomous, but is agitated and hissing. Kevin has access to gloves, hooks, and a containment box. What steps should Kevin follow to safely relocate the snake? Answer: Kevin should first assess the snake's behavior, noting its signs of agitation, such as hissing and erratic movements. He should use a snake hook to gently guide the snake towards the containment box. The hook allows Kevin to manipulate the snake without making direct contact, reducing the chance of provoking a defensive strike. Gloves may provide additional protection, but are not the primary method for control. If the snake resists, Kevin should remain calm and allow the snake to settle before attempting again. Sudden movements should be avoided as they can cause the snake to become more agitated. The Australian Wildlife Handling Guidelines recommend using the hook as the primary tool for non-venomous snakes, as it provides safe control. Kevin should always avoid picking up the snake directly unless absolutely necessary, as this can increase the risk of injury. Once the snake is securely contained in the box, it can be safely relocated to its new environment. Which of the following steps is not appropriate when reporting suspected animal abuse? Answer: confronting the suspected abuser directly. Option C is not appropriate when reporting animal abuse. Doing so could escalate the situation and put both the reporter and the animal at risk. According to the Prevention of Cruelty to Animals Act, suspected abuse should be reported to the appropriate authorities without confrontation. The correct procedure is to document the animal's condition, gather evidence when possible, and contact local animal welfare services or law enforcement. Reporting anonymously, option B, is also acceptable in cases where the reporter fears retaliation. Options and D, documenting evidence and contacting the appropriate authorities are the recommended actions. Reporting abuse through the proper channels ensures that the case is handled professionally and that the animal receives necessary care and protection. Handling the situation discreetly minimizes risks and ensures that due process is followed. How should a professional address an owner who insists on a restrictive diet for their pet that may compromise its health? Answer: A professional should address the owner's concerns with empathy, offering educational resources that explain the pet's nutritional needs. Using reputable sources like the Australian Pet Food Standards can help the owner understand the risks of a restrictive diet, including malnutrition and long-term health problems. The professional should explain that pets require balanced diets to maintain their health and longevity. If the owner continues to insist on the restrictive diet, the professional may recommend consulting a veterinarian for further advice. If necessary, the professional should also highlight that animal welfare regulations require proper nutrition to ensure the pet's well-being. The goal is to educate the owner on the importance of proper nutrition while respecting their relationship with the pet. In extreme cases, if the owner persists in neglecting the animal's health, the professional may need to report the situation to animal welfare authorities. When lifting a large dog weighing over 25 kilograms, which technique minimizes the risk of injury to both the handler and the animal? Answer: when lifting a large dog, the handler should use proper lifting techniques to minimize the risk of injury. The correct method is to bend the knees, keeping the back straight, and use the strength of the legs to lift rather than the back. The dog should be supported under its chest and hindquarters, ensuring it remains secure and stable. This technique reduces the strain on the handler's back and minimizes the risk of muscle or joint injuries. As per Work Health and Safety Publisher standards, lifting heavy animals without proper technique can lead to physical harm. The handler should also ensure the dog is calm and that its weight is evenly distributed before attempting to lift. If the dog is uncooperative or the situation requires extra assistance, the handler should consider seeking help from another person. What are the key ethical considerations when euthanizing an animal in a veterinary practice, and how should the professional ensure that the procedure is carried out with dignity and respect? Answer: euthanizing an animal is an emotionally charged and ethically sensitive procedure. The key ethical considerations involve ensuring that euthanasia is carried out when it is in the best interest of the animal, based on sound medical judgment and with the utmost respect for its dignity. Professionals must first assess the animal's quality of life, considering factors like pain, suffering, and whether the animal's condition can be improved. Euthanasia should not be performed solely to ease the owner's emotional distress, but should be a decision based on a thorough evaluation of the animal's health and well-being. The procedure itself must be done humanely using methods approved by the Australian Veterinary Association, others such as intravenous Euthasol, to ensure that the animal does not experience pain. The professional should maintain clear communication with the pet owner, explaining the procedure and answering any questions. Additionally, the animal should be handled gently and the procedure should be conducted in a calm, quiet environment to minimize stress. The professional must also ensure that the body is treated respectfully after euthanasia, handling the remains in accordance with the Prevention of Cruelty to Animals Act, which regulates humane treatment at all stages. Sarah works as a veterinary technician at an animal shelter. She notices that one of the dogs has been repeatedly barking and appears increasingly anxious every time a new volunteer approaches. Sarah suspects that the dog may have been abused prior to arriving at the shelter. What actions should Sarah take to investigate and address the dog's behavioral issues? Answer: Sarah should first observe the dog's behavior and document any signs of anxiety or fear, such as excessive barking, cowering, or avoidance of human interaction. She should note the dog's responses to various stimuli and track any patterns of behavior. To address the dog's behavioral issues, Sarah should consult with her supervisor and involve a trained behaviorist or animal psychologist to assess the dog's mental health. The behaviorist can provide a more accurate diagnosis of the dog's anxiety, including whether it is linked to past abuse or simply stress from the shelter environment. Additionally, Sarah can help create a calmer environment for the dog by ensuring it has a consistent routine, adequate exercise, and positive reinforcement training to build trust with humans. Sarah should also inform the shelter staff about the dog's behavior to ensure that they are using humane, low-stress methods of handling. If abuse is suspected, Sarah must report it to the appropriate authorities in accordance with the Prevention of Cruelty to Animals Act, which requires professionals to take action if abuse is suspected, ensuring that the dog receives the proper care and protection.